Lee, how about you? I think you're the last one.
Yeah, hi. Sorry, I had to run to the bathroom real quick. So I didn't hear what your question was, but my name is Leah Oladeton. I work at Clay County Public Health Center as well. I'm in charge of the community health program, and I work a lot with Lauren, Monica, and Teresa.
The Clay County is represented today. Look at this. This is great. Awesome. So Sandy works at Johnson County. I used to work at KCMO. And so we have good representation here. So thanks for the introductions, everyone. Let's go ahead and Katie, will you pull up the strategies? So over the last year or so, the team has you know, really worked on what public health organizations can do to support physical activity in Kansas City. So the Kansas City Physical Activity Plan is, as Robin likes to mention, is modeled after the National Physical Activity Plan. And really, we took the strategies and tactics from the public health sector of the National Physical Activity Plan, worked on them to see if they were appropriate or realistic for Kansas City over the last year and have kind of finished that process. And now we're really ready to implement some changes. So, Katie, do you want to just quickly kind of review the six? There's six, right? Six strategies. I don't know if we need to go
Yeah,
into.
yeah, I figured, I'll just pull them up and read them off. If you're interested in reading further about the tactics, I put the link in the chat. And here, after I get done, I'll go ahead and also throw in a link to the PDF of the full Kansas City Physical Activity Plan. The reason it starts on strategy 35, if you're unaware of how the KCP plan is started, so are other sectors. So like, I believe our first sector might be schools. So that's like 1 through 3. So that's why we're starting at 35, because we are the 9th sector to do our strategies. So strategy 35 is public health organizations should disseminate tools and resources important to promoting physical activity. And then strategy 36 is that public health agencies should expand monitoring of policies and environmental determinants of physical activity and the levels of physical activity in communities, so surveillance, and should monitor implementation of public health approaches to promoting active lifestyles, so evaluation. 37 is that nonprofit public health organizations should engage in policy development and advocacy to elevate the priority of physical activity in public health practice, policy, and research. 38 is that public health agencies should create, maintain, and leverage cross-sectoral partnerships and/or coalitions that implement evidence-based strategies to promote physical activity. And 39 is public health agencies should invest equitably in physical activity, commensurate with its impact on disease prevention and health promotion. 40, public health organizations should develop and maintain a workforce with competence and expertise in physical activity and health, and that has ethnic, cultural, and gender diversity. And that is it.
So that's just a quick overview of the strategies. Katie, I mentioned I just put you in the chat. Like a good idea is to like put that in an infographic because it's really, I
Thank
think
you.
around, yeah, like disseminating tools, surveillance, advocacy, partnerships, equity, workforce, right? So that seems to be, I think, a good way to think about that stuff. So for folks that haven't been here before or are kind of newer to the group, or it was like Thanksgiving, Christmas too. So, any thoughts on those strategies? Any reactions, I should say, to those strategies? Yeah, so it's all encompassing, right? Like pretty global. The tactics get into the specific things that we might consider. I will just say that the group here has really thought of two main things that we're really interested in kind of promoting. One is physical activity among public health workers. So, in that kind of workforce strategy, we need a workforce that's healthy, active, able to do public health. And, the science says that once someone themselves is active, they're much more likely to think think about the work that they do or promote physical activity and kind of the other things they do. So, especially for like the community engagement folks, if you're at, I don't know, like a planning session with the local city engineer and planners, thinking through what that looks like in terms of physical activity or those kind of things, you can really be the voice for that. And I think that's the goal for getting, public health workers active, is maintaining a good workforce, number one, right? Like, we know that the public health workforce needs some physical activity, needs some support in that. But two, that then they can, act as champions for physical activity in their communities, right? So the Kansas City Physical Activity Plan, we have funds. We have about $15,000 per sector to implement, the tactics and strategies of our plan. And so I'm curious, what we've talked about in the past is really, supporting some physical activity programming at local health departments. That could be like, Lauren, having you, like, I don't know, paying you or part of your salary to deliver, group-based fitness, either at Clay County or other places, having other groups come in. I think of like, KCMO is where I worked for the longest time. And, KCMO has a big Berry auditorium, the big space in the atrium where, it's perfect for some group-based fitness stuff, we've done some stuff there in the past, but it's been, a long time. And so what do you guys think about contacting the local health departments to see if, if they want some physical activity classes or programs?
I'm on the internal staff education committee at CCPHC, so that is something that I could bring to the next meeting. If that's something, I think that we've tried, and I don't know, Teresa or Leah, if either of you remember, I know that they did staff yoga at some point, and I'm not really sure what was up with that fizzling out.
So I know at least here I was actually approached about this already very casually, and I was like, yeah, sure, let me know when, and then nobody ever got back to me. So I think we are open to it. It's just finding that extra time.
Sandy, Teresa, yeah.
I reached out to our he's environmental health specialist, but he deals with our wellness plan. Brandon, he told me to reach out to his boss's boss. So I sent information to her about, about these meetings, about what we're doing. I haven't heard anything back yet. I don't think I've ever met Jenna, but I could send that information to you, Joey, or somebody to get information there too. I also talked with Barbara Mitchell, and she's part of the CHIP planning committee, I think. She said there is no, I don't know when this happened. It's been very recent, I guess. There is no wellness objective in the plan, physical activity objective in the plan, the CHIP plan now in Johnson County. Don't know why, because it's always been there, but just thought I would update.
Thanks, Sandy. Is there an obesity objective in the plan?
That is a good question.
I'll Google it real quick.
Yeah. I think it's linked to our website, but it's so difficult to find. But I can pick it up. It's
I
like
can find it. I kind of, it's all a language thing. I kind of know how to find it. Leah, you want to go next?
Oh, okay. Well, I'm going to turn my camera off. I don't know why I'm upside down. That's so weird. Yeah, so Teresa might be saying the same thing, but I had a couple thoughts at the health center, and Lauren and Monica, you might be able to help with the committees you're on too. We have a wellness day that we do specific, if you're thinking about staff, we have a wellness day that we do for our staff. That would be a good opportunity to do it with the staff. And then we also have, part of one of the things I oversee is a maternal child health contract. And so we have like a family fitness day, like a family health day that we do every year. And that's a community event where it's at Mackin Park. But we have that as another opportunity to do some education as well.
That's awesome. Yeah, I mean, I think that if there's any funds that you guys need to promote physical activity or any of that kind of stuff, we just have to apply for them, and it's like super easy. So don't think it's like a tough application, but it's essentially like, I'm happy to help with it. Just essentially a paragraph of like what we want to do, and then I can fill in kind of the other stuff, how it relates to our plans and what we're thinking of. But if you need money to like bring somebody in to do more activity, to give away things, happy to help support that. Teresa?
I was going to suggest, and Leah, I thought that was what you were going to ask. In the past, we have gotten Tony Temple, Tony Temple, the past MU football player, and he's been one of our features at Family Fun Day on the big stage in Mackin Park, doing his animal movements thing with the kiddos. And you talk about the phrase rock the park. He rocked the park. So I was thinking maybe that is something we could use to help pay. We've talked to him briefly, and I know there's going to be more conversation about maybe offering some of the early childhood centers that we're working with on our grant to have him go out and do a little spot. It's something that the parents are going to be present for. So I didn't know if those funds would be appropriate for something like that we've already got planned that is focusing on physical activity.
Yeah, I mean, I think folks are always willing to entertain ideas of how to spend this money. I think as long as it's related to the strategies and tactics that we have, I think the groups are pretty responsive to those kind of ideas. So yeah, I think put it in a like a paragraph, and then let's talk about it here and push it forward, I think.
So can I step in really quick about the funding opportunity and these implementation applications? So for those who are new, there's an opportunity to ask for more money from other sectors. So part of the application, if you can involve more than one sector. So let's say you want to do this idea, but also bring in like the park sector to do maybe like a group session at a park that's nearby a health department. Like, I'm just being random here. You can ask them in their sector for more money. So there's an opportunity for more than just 15,000. 15 is what we have for this sector. And you don't have to ask for all of it if you have a small project idea that's only like 2,000. So I just wanted to go ahead and mention that. And I know I threw in the chat earlier, the KCPA plan itself and our website. So if you are unfamiliar with any of the strategies of any of the sectors, you can go back there to refer to fill out the application.
And I think you put the file, the application file in there too, right?
Yep, so that Word document is the application. And if you have any questions, feel free to email me, and I'll also put, well, Joey, can you put yours? I can't remember it. Or you can email Joey.
Yeah, and any wins, how do I say this? Like any win is a good win. And so how we spend those funds, I think it's really like first come, first serve on, what we think those funds should go to and move it forward. So let's put that on the agenda for next time, if that's cool with everybody. Go ahead. Sorry.
Along these lines, when we're thinking maybe down the road this year, we might want to partner with our business and industry sector. They're just in the phase of going through their tactics right now, but two of them in the national plan relate to working with people in the public health sector. And I think voices from that group are currently missing from our business and industry sector. So as they look to, I'm looking at their tactics, and I think they're mostly around data collection and tracking and working with workplaces, assessing the environment of workplaces for improvement for physical activity. And I think designing a project with them might be something we'd want to look at.
Yeah, Natalie, I totally agree with that. And the early childhood sector, if we're thinking about like Teresa, you mentioned like early childhood institutions, like that could be a good one, right? Like Katie said, parks. If there's anybody else that we want to you know, talk to about, I think that would be good too. Other ideas, I'm going to get to Sandy's point around chip chaw stuff, which we will talk about here in a minute, but other ideas of implementation that we should talk through today? Okay, let's switch gears. So Clay County, public health folks, we know this, right? So I should say I do quite a bit of work on like public health infrastructure and how the public health system works together, especially with health hospitals, nonprofit hospitals, and this chip chop process. So one thing that I think we can make some meaningful progress on in Kansas City, it's simply just working together more, right? So Clay County, you guys just finished your chip, is that right?
We're in the middle of our 23 to 25 chip cycle. So we are actually, gearing up to start working on the next CHA for our following cycle pretty soon.
Yeah, and you guys fall on the 3-year cycle because you wanted to match up with your hospital systems, right?
Yeah, I believe so.
Yeah, which is great. Most health departments do not do that. Most health departments only do a 5-year chip because of accreditation, right? But as Monica and the rest of the team knows, you know, the nonprofit hospital systems have to do a 3-year CHA chip. It's a CHNA and implementation strategies plan, but essentially it's the same thing. So you know, how we all kind of get together on the same page, how we get on the same cycle of CHA chip stuff. You know, the areas of Kansas City Metro are different, right? But they're not significantly different. You know, the stuff that we're all dealing with, like transportation, access to care, access to employment, right? They're all the social determinants in Kansas City are pretty much the same, right? So, you know, I'm curious, especially the folks from Clay County, what you guys think about this is, you know, is there some willingness from health departments and hospital systems to get on the same page with the CHA chip cycles, not only maybe in terms of timeline, right, but also in terms of like what the Metro is facing, you know?
So for the Northland, we work Clay County Public Health and Platte County Public Health are kind of the two larger players in the Northland Health Alliance, which involves the majority, really all of the larger hospital systems that are serving in the Northland. And we do all work on and share, well, not all of us, but a lot of us work on and share the same chip and CHA. So there's a lot of like coordinating and similar efforts going on for sure.
Yeah, exactly. I think though, Monica, you guys are in the Kansas City metro area, the Northland, you guys are doing really great work up there. I think the rest of the area can learn from you guys. What do you think?
Well, we will provide whatever helpful information that we can provide.
So, especially when it comes to physical activity stuff, right? Like, I mean, you know, the strategies, the funding, the partnerships, I mean, it's all the same, right? Bike Walk is doing the majority of bike ped infrastructure stuff in the metro area. ATA is the transit group, you know, and so I think that if we can get health departments and hospitals to work together more on the CHA chip process, I think that I would be interested in Monica, everybody else, on what you guys think. Is that a worthy endeavor to maybe help share and utilize funds, help share, get
Mhm.
everybody on the same page so we can work
Mhm.
together?
I definitely think it's worthy, and I think it's been an overall really good experience. One thing that we have definitely learned though is to keep in mind, A, like when you're approaching about sharing it, and B, just throughout the process, that every hospital and every public health department is still, regardless of sharing that chip and chaw, like they're kind of going to have their own carrot at the end of the stick for being there. So sometimes even amongst the same CHA, priorities can be different, and it takes a little bit of coordinating to work that out.
Yeah, and I don't know if a like metro-wide chip chaw is perfect or ideal, but just I think that just sharing and like trying to get everybody on the same page of like these are our overarching problems in the city that we all suffer with, that if we can, you know, develop some coordination on, we can actually make progress instead of,
Mhm.
what do you
I
think?
think that as a person who has spent the majority of their career living and working in Jackson County and being newer to the Northland and Clay County, I do see a lot of differences. Um, I think especially when it comes to transportation, like definitely all of the underlying issues are the same, but I think that they are way magnified up in the Northland. Cause like the transportation is horrible. And I know that it's horrible all over the Kansas City metro area, but it's depressing in the Northland. But then I think that there's also like other, yeah, I definitely see room for like some things being able to be like a metro wide sort of initiative, or at least push.
Yeah, I think Monica, I think that like the Northland and Johnson County have very similar transportation problems,
Yeah.
right?
And
Whereas,
that's actually where I grew up, is Johnson County. So I've had like a real taste for all three different parts of the metro at this point. And
yeah,
it's built to not accommodate that kind of need.
yeah, like active transportation is terrible, right? Where like Casey Mo and Wyandotte are more similar and kind of like the active transportation space, and like the Northland and Johnson County are kind of more similar.
For
There's more
sure.
much more trails in the Northland and Johnson County than in like Casey Mo or
Right. Geared
yeah.
towards
So
leisure, not fulfilling actual like needs.
yeah. Teresa?
I just want to say, I think I've worked here 19 years in Clay County. I grew up in Jackson County. I think that over the years, all the different groups, collaborative groups that I've served on, it is very obvious that people that live south of the river have, and especially people in power, have the misconception that we don't have very many what they want to call poor or underprivileged people in the
Mhm.
Northland. And that is so not true. I did home health in 5 counties north of the river. And at one transportation meeting at Mark, I said, I would be glad to take anybody that wants to go with me on a mystery ride, and I will show you the poor and the homeless in the Northland. So I think that that's one of the big misconceptions that we constantly are fighting in the Northland, trying to get services for all of our people. And it's probably the same in Johnson County.
And I think that's a really good point, Teresa, because I think you're right. As somebody who has worked in KCMO, the overwhelming majority of my time in Kansas City, I view the Northland as like, oh, they're good, whatever. But being like, if we work in a metro-wide format, right? Being able to share that and say that, hey, we have equity challenges in the Northland, just like there are, in the, south of the river, I think is really valuable and something that can like maybe help folks south of the river understand that like we need services in the Northland the same or maybe more than some of the services that, because most of the social services are located south of the river, right? So I would be interested in the inequity in social services in the area. Sandy, were you gonna say something? Oh,
No, I totally agree. There's a lack of transportation. And I think even though Johnson County was mostly, middle class, upper middle class population there, I have definitely seen some need, a great deal of need in Johnson County too, so.
And I would
And
absolutely
we-
agree. Oh, sorry, go ahead, Monica.
I was just gonna say, like, especially Lauren, Teresa, and I, when we're doing our work, a lot of what we are doing is trying to like connect with these resources that are primarily serving south of the river from like, Lauren has been working on building our relationship with Bike Walk, Canby's Markets, Kansas City Community Gardens. These are all like such big names in the metro, but they hardly have a presence at all in the Northland. And that's a big part of what we're trying to build up is how can we get some of these awesome organizations to come and serve up north. Because again, like just like Johnson County, people don't think of like, the Roland Park areas, like those super northern parts, like those are here and they need those services too, even though on paper it kind of washes out.
Yeah, our big challenge too is that sometimes it's difficult to refer people to resources south of the river that they would be 100% eligible for because they just don't have any reliable way to get there. So I think like a shared chip and chaw could be useful for the metro as long as that implementation piece was loose enough to accommodate for the very different needs and resources available for each area.
I mean, I'll say this again. I don't know if a shared chip and chaw is ideal or perfect, but I do think because the areas are slightly different, right? And we have to understand context in all of these terms. But I do think if there's a way we can all kind of get on the same page with like transportation, inequity, access to care, like the things that matter, and of course physical activity. Like that's why I'm here, and I hope that's why a lot of us are here, because like we care about physical activity and want to improve the environment for folks. And so if that's like an overarching like chip chaw for the metro or something like that, that then the health departments, the hospital systems can take into account and align their individual chip chaws with, there's something I'm trying to talk something that like gives some flexibility and serves a purpose. I don't want to duplicate work is the problem.
So
Lauren?
maybe just like coming in collaboratively if agencies want to bring in their chip and chaw, and then we can say, okay, where does this overlap? And on those overlapping areas, where are the resources? Where are the gaps in resources? And just kind of create some kind of document or database to say like these are the things that the whole metro needs. These are the gaps. How can we fill those?
Yeah, like this is what all the chip and chaws are working on. All of the things that, all the public health departments, all the hospital systems. This is what we see as like, needs for the entire metro, right? And then that could be, I think that's really valuable. And just like connecting, I hate to say it, but just connecting the people who work in the kind of chip chaw world from all of the different organizations would be valuable. I'll throw another layer of stuff in here. My team has done some research on kind of the cost and implementation of chips and chaws. And so we have that data that we can present. We've also done some work on a representative sample of accredited health departments and which kind of implementation strategies health departments use to impact physical activity. So that's something that we're happy to share. Like there seems to be this mismatch nationally among health departments and physical activity. So what we found, we have all these different measures that measure all these things. And what we found is that health departments are kind of safe. They'll implement things that are like kind of low-hanging fruit, like partnerships and forget the other ones, but I could send you the paper. But the things that really impact physical activity, like policy systems, environmental level change, health departments are not working on that. So it's interesting, this mismatch between like, we know what works and what we should be doing. But in reality, we're, over here doing these other things that maybe have downstream effects on those things. But, we've all been in rooms where there's a lot of talk and never action.
And I think that like at least for our like CHA and CHIP process, like I love the idea of an organization that's providing like guidance on best practices that folks can be making sure they're incorporating or taking into consideration when they're making their own like organizational CHIP. Because and I think Teresa and Leah might have a little bit better idea, but I can't off the top of my head think of anywhere where like physical activity is super emphasized in ours, except maybe like, I don't know, maybe some like environmental stuff with like green space and having access to, be physically active and enjoy the outdoors. And I don't even know if that's there, honestly, because there's like a somewhat narrow section of that CHIP and CHA that is what I spend the majority of my time focusing on. And it wouldn't necessarily be there, but I don't believe it's anywhere. But I would absolutely advocate to bring like you all as an organization in for some occasional guidance and perspective when we're initiating that next CHA process. I think that would be amazing.
Yeah, for sure. And I think that that's kind of our role, right? Is that
Mhm.
trying to get folks to think about physical, because we know that here's the thing, right? The CHIPs have generally gone on a cycle where, we in the like early 2000s really focused around individual behavior change, right? Physical activity, nutrition, those kind of things. Some health departments maintain that longer than others. And then there are health departments like Casey Mo that really kind of went far upstream determinants, like to focus on like the newest CHIP that I led was on racism, right? And how do we combat institutionalized racism in Kansas City? And so like, it's I guess, how do you say this in a way that like knowing, just so everybody else knows, knowing that I led that last CHA and it may not be actionable, like how do we develop CHIPs that are actionable and can help improve whatever it is outcome that we want to improve. That's hard.
The one thing that, because I've worked on this MCH contract, with different focus areas for a long time, but at one point, this has probably been over 10 years ago, I worked on physical activity. I think that it's sad how our schools are decreasing over time, more and more the amount of PE time that kids get in school. And I jumped on the fact that what are our kiddos that are living in Section 8 apartment complexes that are dangerous, that unless the parent goes out, if there is a playground area for them. And at that time, I talked and actually got the YMCA to give me several scholarships for kiddos to join, but then we had to figure out how to get them there. Those are the kiddos. That's why I like working with daycares more. I think you form the desire to be physically active when you're young. It's hard to change a kiddo that's already in middle school and high school, and especially with the school not even supporting physical, activity anymore. I think that's a huge thing.
Yeah, I mean, the evidence definitely supports that, Teresa. I will say that, middle school is kind of the perfect time to intervene in a kid's life if they haven't been active before, and even if they are active, because they go through that secondary phase of socialization where peer groups are more important than family groups. And that's when they really learn that 10 to 14 age cohort is where they really learn the behaviors that they're going to carry through for the rest of their life. And so it's important to get young kids active, right? But if we forget that like middle school cohort, that's really the time in which health behaviors are solidified throughout the rest of life. And so That's the intervention that we have in KCPS middle schools. That's why we focus on those. Okay, so I think for next steps on that, I mean, I'm interested in what anybody has to say, but I think next steps, I think we should plan something where we can get folks in a room from, you know, the different organizations. And I think the first step is just sharing kind of the chip chaw stuff. And so if I don't know if Katie or Natalie or anybody else has some time, if we get the chips to you guys, can you kind of put it in one document and then like see where there's some overlap between the different cities?
I don't think I'd have time by the next meeting. Yeah, I probably need a little longer than a month.
I could probably get Nancy to do it if you know.
I could
she-
work with Nancy
Okay.
and yeah, as long as I can get some help.
Yeah,
'Cause I've
for
got
sure.
some other projects with my other sectors right now, but
Well, and
It's
Nancy's
hard.
really good at findings. As we all know, government websites are absolutely terrible. They're trash, right? Let's be real. And so if Nancy's really good at, because she's worked in public health systems for so long, she's really good at finding what she needs to find. So she can help with that. And then she could be one coder, Katie. And if you just want to be like a second coder, just make sure that what she coded was appropriate.
yeah, that would work great. Do you want to reach out to her and
I can, yeah, I'll just
Or-
pop you guys on an email for both of you guys.
bye, Natalie?
Bye, Natalie. Let's do that, and then let's try and find a time when we can invite some folks and just share what we found. Is that a good first step?
That sounds fine to me.
I mean, if anybody else has any other ideas, if they want to go further than that in the next month, I'm happy to entertain. We're a group. It's not just, you know.
I do have a quick question going back to the funding that you guys said you had. Is the funding specifically for public health employee wellness? Or if we can think of ways to promote physical activity in the community, is that also usable?
So as long as it aligns with the sector's strategies and tactics, that's kind of the goal. And scoring, so the application I posted in the chat, it does include how we score. So it's really easy. So what we do first is we review it as a group and make sure that it aligns with our sector strategies and tactics. And then we bring it over to our core work group. So the core work group is our sector co-lead. So there's 10 sectors in the KCPA plan, just like the national. And they'll review it and do a final score and so you need 7 to pass. I think Joey's bringing it up. Okay. So you'll have a group who will help guide you and make sure it aligns. But yeah, it doesn't have to be in public health departments. It just has to relate to what Joey's pulled up. Does that make sense?
Okay, yeah, we had just discussed it when we were talking about employee wellness. I wasn't sure if it was specifically for that or for all
Yeah.
of this. Okay.
No, we had these ideas. We've been discussing it for a couple months now, or a couple of our meetings, just that idea about employee wellness. So that's why we brought it up today.
Okay, because I was thinking maybe it would need to be fleshed out a lot more, but since transportation is such an issue throughout the metro, and schools are usually a great way to get kids active is through schools. And at this point, most schools have technology, they have app subscriptions that they can give out to their students. If there was some kind of physical activity app, like Les Mills has a Born to Move program that's really cool, and it's very age appropriate exercise for children. And so like my kids did a lot of it during the pandemic. But I know there are some that are more specific to like PE type things. So that might be something to look into.
No, I love that idea. And we actually have a school sector and we have funding available left in that one as well. Right now, the only implementation project we've passed in the school sector is actually it was only specific to USD 500 school district in Wyandotte County, but it was teaching Ply Yoga to all of the PE teachers. So like we're kind of stuck in the school sector. And what you brought up is a great idea, because I know you just mentioned transportation and infrastructure. Our next meeting is actually coming up, and we are focused on planning for bike and roll to school day. And one of the things we talk a lot about in that sector is safe routes to school. So while it's not that PE app, I think that if you wanted to come join one of our meetings and bring the idea up, we could see how we could collaborate with the public health sector.
That would actually be great. So for the NHA, I'm the community liaison for their transportation task force, and I think that could actually be a really valuable partnership for us.
And Katie, is Bike Walk leading that group?
No, so we're looking for another co-lead in our school sector. So we only have one right now, and that is Christine, and she is the physical education coordinator for USD 500. We do have an infrastructure group, but they have been on pause for the last year. So they're just starting back up, and that is Bike Walk KC.
That's what I thought. I'm sorry.
Other
No, it's
resource
okay.
might be the FQHCs. We have some large federally qualified health centers that are, points, especially for that exercises medicine. Our primary care doctors should be asking us, demanding us to move. And that might be another relationship. And I was thinking, Clay County, used to have a school that had a clinic there in it. I can't remember the name of it. It was like I don't know whether it was a primary care clinic or more for.
Yeah, I can
what
speak
was the
to
name of
that.
school?
I
Yeah.
was the clinic manager in those days.
Okay.
We started a primary care clinic with
Yeah.
through Sam Rogers at Crestview Elementary, which in the North Kansas City School
Yeah,
District
that was it.
has, at that time, there were over 47 languages spoken in that school. So that was probably, if we had to pick out of all of the North Kansas City grade schools, probably the most at-risk kids. But
Yeah.
then when Sam Rogers took over our primary care clinic, they closed it down in less than a year, sadly.
Oh,
Yeah,
what
we,
was
the
that?
health
Mhm.
department, had a 5-day-a-week, very busy, that I managed
Nurse.
primary
Yeah.
care clinic, and then Sam Rogers took it over.
Okay, I had lost track of that, but I know that's that's the FQHCs, the medical piece of it, bumping up against, the neighborhood, connecting into that socially dynamic atmosphere. Like you said, how many did you say? 40 languages?
Well, over 47. I remember that number is indelibly etched in my head because that was one of our big challenges to figure out how to reach out to those families, and we
Mhm.
were able to do it.
Yeah. And then I jumped in your meeting late. I apologize. I've been dying to get in back involved. There, let's see, what was the other? Yeah, it might be. I could make some contacts if that's something we want to, see how that might work, or it wouldn't have to be at the school, but it could be coordinated directly, in some type of community setting, where we could do some events, but ultimately the tracking and the wearable devices and all those, a lot of that's starting to be covered through the insurance. I know and I'm going to jump up to the old folks, the Medicare managed care companies, a lot of times they'll cover that PERS, it's called. It's like it's a emergency device, but it also tracks their heartbeat. They get a watch. So those Medicare qualifying, or if they're covered in Medicare through disability, SSI, they have a disability and they're receiving compensation for that along with the Medicare coverage. So that piece is nice, because you really need some way to measure that activity. And if the insurance company covers
Can I
it.
jump in? Can I jump in here for just a second, Dan? I'm sorry. So I
Yeah.
don't want to interrupt you and like stop what you're thinking here, but I do want to, we only have like 4 minutes left in this meeting,
Yeah.
and I just make sure that we get what we want to
Absolutely.
kind of the conversation that we've had today.
Okay.
Okay, sorry about that.
No, that's
So-
good.
So, so that, I mean, what do you guys think about next steps for the chip stuff? We can get together with Nancy and identify, kind of put together maybe like a 1 or 2 pager of priority areas in the city, send that out. I'm happy to send out any of the papers that we've done on physical activity and chip chaw stuff. And maybe that's enough of a, hook for folks at health departments, nonprofit hospitals who have to do these things to come to a meeting and talk about maybe ways that we can collaborate. What do you think?
I think that'd be great. And we also have already had a conversation with Bike Walk about potentially sharing some data where it's available. They might, I mean, I know they're not public health, but they might be a good organization to have come to the table for some of these meetings because they do have so much data on physical activity and transportation. And if you'd like, I have a meeting with them today at 3 if you'd like me to ask them to.
Yeah, if you want to, Lauren, Bike Walk is on, we have a CDC funded REACH grant that they're leading the physical activity section for, and like we work with them. Amanda, my colleague Amanda, was on the board, and Robin is on the board of Bike Walk now. And so they're not only like funded through our grants, but also like we just work with them a lot.
Okay, so you guys probably already have all of that then.
Yeah, we
So-
probably do. We can either share or get them to share. That would be, no biggie for them because they're so good with that kind of stuff. So yeah, and so if we identify, maybe the next meeting we could come, if we can get the priority areas done and sent out to you guys by the next meeting, then next meeting we can kind of strategize what we see as missing pieces in the metro that we can all kind of get around together. And I will say that the outcome of all of this, for me at least, is like we need funding to do things, right? And so if we have these priority areas focused regionally, we can then go after and go to funders and say, we've done this work already. These are the things that we need to work on. This is supported by the Kansas City Physical Activity Plan, all of these CHIPS CHAWs, right? And I think we're much more likely to get some bigger dollars than the small intermittent pieces that we all kind of work on separately.
Love that. So I do have to hop to another meeting though.
Thank you, Lauren. And we'll chat next time.
Thank you.
Hey,
we
Joey,
have 2
give me
minutes.
can I get your email?
Yeah, of course.
Joey?
I'll put it in the chat for you, Dan.
Okay.
Yeah.
If you've got my contact information on there, I'll team up with you.
Yeah, for sure. So, so we do have 2 minutes left. Sorry, Dan, I had to just put the bow on that in order to move forward on it. Any other questions, discussion for today, guys?
I don't have questions, but I have a couple announcements for anyone who is still on.
Shoot.
Great. So, one of our sectors is media and communications, and we are launching a physical activity campaign called Move Together KC. I'm not going to go into too much detail, just that we are still looking for stories. So we want to know why you move. We will use this in our social media, but if you have a moment and you can fill this out, we would love some video responses, but you can submit text. I am posting the link in the chat. And then also follow us on social media. There is more to come. Again, I'm just trying to keep this really quick because I know we're low on time. And then the Kansas City Healthy Lifestyles Collaborative also has a quarterly meeting coming up, which is March 14th. I'll just post that in the newsletter. I don't have the link available at this time. We're still coming up with a guest speaker, but just wanted to put it on everyone's radar to save the date. And that's all I have. And then the next meeting, which is February 15th. And here's the link to register. That was a lot.
And it's 1 o'clock. So thank you all. I'm sorry, I have to run to my next meeting. But thank you, Sandy. It's always good to see you. Katie, I miss you. Teresa, good to see you. Bonnie, Dan, thanks for
Dan,
coming.
thanks for joining. Bye, guys. Thank you so much.
Adios. Adios.
I know.